So everywhere I go, people find out I'm a dentist, immediately start asking me a bunch of dental questions. So I thought I would start a new series called Frank Explains. We're just going to pick a topic every week and we're going to explain it. And today it is going to be what is the difference between a veneer, an onlay, and a crown. So a veneer is a very thin shell of ceramic that goes over the top of your natural teeth. There is some preparation involved in most cases. How much preparation really depends on where you go and what generation of ceramic they're using and how much change you want to make. If you go to Turkey, they will hack your teeth. They will look like little stumps and you have ruined your teeth forever. If you come and see us or another reputable clinic and they're using modern ceramics, because they're much harder, we prepare it much, much less. Can get some color improvements, you can get some positioning improvements, you can get a lot of shape improvements, but really it's designed for minor corrections and to really kind of give you that kind of go from good teeth to great teeth. An onlay is for your back teeth. Essentially, we cover the biting surface either fully or partially with ceramic. It is much, much harder than a normal filling, which is made out of composite or amalgam. The ceramic or hybrid ceramics are significantly harder and more hard wearing. We do this to protect the rest of the structure of the tooth, to make sure you don't have any breakages or you have any bacterial ingress or anything like that. And the final thing is a crown. So this is if you want to do significant changes to the shape of your teeth or the color. We really have to prepare the tooth quite a lot. It's often used for like broken down teeth, heavily damaged teeth, cracked teeth, teeth that you've like broken a piece off of and we're worried about the rest of the structure. So it's a bit like an onlay, but more. And then there is the age-old question of, why do a crown versus an onlay? Generally, you'll find that an older dentist will probably favor a crown, a younger dentist will favor an onlay, and I'm not too old and definitely not young, so I'd probably do something. I do a mix, and is kind of case appropriate. And then the final question is what happens when does an onlay become a crown? At what point? There's a lot of overlap between the two, and how much of the tooth do you need to prepare, or how far close to the gum do you need to go with your onlay before it turns into a crown? And no one can really explain that. I still don't have an answer for that. I'm still trying to find that out. So there you go. First episode of Frank Explains, and Frank couldn't explain. So hopefully the rest will go a bit better than today. Thank you.